I was referred by another dermatologist. I had a skin cancer on my nose, one of many. I probably 35 years ago started attending or going to a dermatologist, and I've had quite a few surgeries. I've had surgery here, which was a stage 2 cancer, and then my nose on my face, I've had many, many surgeries, and I've had the face pill twice. So I've had a lot going on. And at that dermatologist's office, he can't do the Mohs surgery. And there was a spot on the side of my nose that he cauterized, and he got the results back. And it was not good that he did not get all of the cancer. So he referred me to Dr. Winchester, which probably, I'm a firm believer that things happen for a reason, and that's probably the best thing that ever could happen to me, because Dr. Winchester works miracles. He just, when it came in and said, "Oh, I'm going to put your cheek over here on your nose," and I'm thinking, "Oh, sure," But I knew the doctor that referred him, and I had faith in both of them. So when I came in, yeah, that's what brought me here, half with all the history that I've had with cancer, spots and surgeries on my face. He just did my forehead. And, yeah, I just have all the faith in the world. And I think I was put here for a reason. And, you sit in this chair as he's cutting your face. And I'm one of these people that would love to be able to watch, but I could see through my little thing right here. I could see what he was doing. And until he sliced down here, until he started kind of peeling my face back, then I started saying my prayers. I thought, oh my gosh, what's going on? But, and I do have pictures that show the progress of my face every month or week. I'm not sure what it was, but I can tell that I still have scars, but people that don't know me can't tell. And that's what's nice. I mean, after you spend that many hours and your faith is in this man who is a lovely man, I feel like his staff and his surgeons and the people that assist him, we're all like family. And like I said, I see them probably every 6 months more than I see a lot of my family, But I just love Dr. Winchester. I know he's so busy with his schedule. I realize, I get that. But when you walk in here, you are the only person he cares about, and that just makes him a good doctor. He doesn't make you feel like you need to rush out of here. And he will wait until you're through visiting or looking or asking questions. And he just makes you feel very comfortable. I was raised in Nevada, in a small town. We lived, of course, with the fair skin and that. My dad had fair skin, blue eyes, freckles, and he had a lot of skin cancer. And in those days, they would just kind of slice and dice and hope for the best. But, in my generation, there wasn't sunscreen. So, and I was raised at the lake. I was raised out. And honestly, I will admit, I did the baby oil iodine bake. And oh my gosh, if I could have any advice for anybody, it would be your children they put their socks and their shoes on, they need to put their sunscreen on before they go outside. All the time. Not just in the summer, but all the time. I honestly do not leave my bathroom in the morning without putting sunscreen on. And I have a sunscreen regimen. I even take my hand lotion, my favorite hand lotion, dump half of it in another container, squirt a jar or a tube of sunscreen on. So I have sunscreen on all the time. I do Epionce, some Epionce products. I know it's expensive, but it's good. It works. And I just do take vitamins, and I've been prescribed, I can't remember what it is, but it's for the skin, twice a day. I do that. But yeah, But I peeled as a child. I always had a peel going somewhere. And there's no excuse for that now. There really is no excuse because it it was in my mid-30s when I started coming to a dermatologist, and I've been going every year or every 6 months since then. And it's not, I think I take better care of my skin now than I ever have. But it's damage from way back when. And that's just one advice that I just, you know, cancer is scary, and skin cancer is scary. It is. I think it's a good visit when I come to Dr. Winchester and I only get several spots frozen off. So, I mean, yay, but you just never know. Yeah. Well, the small town dermatology office is a little different. It wasn't as friendly, and it's a small town. It's so the doctor was more businesslike, not as friendly, I don't think. And I just will not go. I'm not that I wouldn't go back there, but he didn't have the Mo facility. I'm sure he could do that surgery, but he didn't have the Mo facility. And I just think, why go to a dermatologist who can't finish the process? Why should we have to wait for a week to get results on something when you can just sit here and wait for the however long it takes them to look and make sure? Because I know on my face he did have to come back and do some more digging in. And so why wait? Why sew up everything and then wait and then have to redo it? I would not have it. I would not do it any other way. I also have referred gently a lot of my friends and people I know to go to a dermatologist. And I do refer them here, just simply for the reason I said. Why wait? Why wait for a week? Because that's heart-wrenching, honestly.